What is good, everyone? This is your host, Deanna Radulescu with Label Free Podcast. To live your best life, you must live label free. As always, bring incredible guests from all over the world, so sit back, relax, and tune in. My next guest is a healthcare entrepreneur, CEO of Oar Health. He has revolutionized the way people approach alcohol use disorder, and with over 15 years of experience in the healthcare industry. Please welcome Jonathan Hunt-Glassman. Jonathan, welcome to the show.
Great to be here.
Should we tell the audience a little fun fact that we're recording this actually for the second time?
We're all about honesty and transparency.
Yes. Unfortunately, I'm sure anybody that follows me on social media knows that I had a major freaking breakdown with my computer. So Jonathan is coming back and we're redoing this episode. So it's going to be even better for you than the first time. So Jonathan, I know that you have a very intimate relationship with what you've created and the reason why that you started Oar Health. So let's begin with that and what put you on the journey to revolutionize the way people use treatment for alcohol use disorder.
I started Oar Health, which offers access to a daily pill to drink less because it was the sort of solution that I needed. I struggled with alcohol misuse pretty much my entire adult life. What started as binge drinking in high school and college became a pattern of drinking to blackout. And then in my late 20s and early 30s, as I saw some peers start to grow out of that sort of excessive alcohol use, the opposite was happening for me. I was having more frequent, more severe binges.
Yeah, well, and I think a lot of people do that though when they're in those earlier stages of life, just kind of on that woohoo party path, and just some of us grow out of it, some of us don't. It tends to maybe carry over until a little bit later, until 30s, 40s. And what was that moment for you when you're okay, this is starting to become too much, and I need to just kind of get not get help, but change my relationship with alcohol?
Well, it was no secret to me over most of those 15 or so years that I had a drinking problem. I was seeing it show up in my physical and mental health. I was experiencing social and professional consequences. It was negatively impacting some of the most important relationships in my life. I think the scariest wake-up calls were things like needing to go to the emergency room after falling down a flight of stairs. So I had a lot of wake-up calls and actually sought treatment in a lot of the places that first come to mind, not just the emergency room, but Alcoholics Anonymous, individualized therapy. And while those were helpful in certain ways, they didn't really help me cut back on drinking, which was the main thing I needed to do.
And it's not necessarily that you wanted to stop drinking altogether. It was just to change your relationship with drinking. And I'm starting to hear this a little bit more in our society, which I think is great, because I think that we don't have to be so hard on ourselves because we're indulging. Because I think some of us have that button that once it gets turned on, we're just going to go. And we have to learn how to hit that pause, but oh, pause. We need to slow down because, I'm kind of like that, type A, it's when I'm in, I'm all in, and it's just I just want to go woohoo, and take me to the moon.
Yeah, the truth is there are all sorts of ways that people use and misuse alcohol. And my main problem was similar sounding to what you're describing, which is I would have occasions where I could have one or two drinks and be fine.
Yeah.
But also had way too many occasions where somewhere around that third or fourth drink, there was a runaway train leaving the station. And so that really influenced my goals, as described, in that my goal was never really sobriety. It was much more to take back control for alcohol.
Right. And why do you think I don't remember if we touched on this before. Why do you think we lose control over that?
Well, there's a pretty straightforward biological explanation in that alcohol kind of acts on the brain to lower inhibitions. And so it makes us less good decision makers about whether to have that next drink, whether to maintain control. And what takes over is this reinforcing cycle where one drink feels good, you have a second, that feels great, and you want a lot more. And so that is one reason I think that the solution was ultimately most helpful to me. Prescription medication that could help interrupt that feedback loop ended up being a useful tool. It's hard to, and I'm kind of quoting actually one of our Oar Health members here. He said, it's hard to make better decisions when alcohol is making your brain less of a good decision maker.
Well, right. It's you're numbing all those different things that are in your brain that's how you would say no, like, flight or fight, it's until like it just numbs that part of your brain where you'd be like, okay, well, no, this is probably not a good idea. Now I've never taken any medication for alcohol. And I think there's many different kinds, right? And so I think it would, before we talked about the different kinds that you take or offer with Oar Health.
Yeah, there are 3 medications approved by the FDA in the United States for the treatment of alcohol problems, which is 3 more than most people have heard of.
Yeah.
The recommended frontline medication is the one that I ended up being prescribed by a primary care physician. It's called naltrexone. The way it works is it cools off the pleasure and reward pathways that alcohol activates, and so can be helpful in drinking less, and then over time having fewer cravings for alcohol. You can think of it as kind of a brake on that runaway train that some of us experience.
And that's not the one that makes you sick, right? Isn't there one that you can take that makes you, if you have any alcohol at all, it makes you sick and like throw up?
That's absolutely right. That's called disulfiram. What's the first medication that was approved by the FDA for treating alcohol problems? If folks are aware of medication at all to drink less, it's probably the one that they have in mind. It's what I had in mind when I first talked with a doctor about this.
Yeah.
And so I was pleasantly surprised, as are many of our members, to learn that there are more options than we may be aware of.
Yeah, because now for you personally, you still are able to have a drink socially without jumping on that runaway train.
Yeah, my goal has always been moderation. And so I found that with medication plus a plan to drink less, some clear, bright lines as to success, which I've always defined as no more blackouts, and some concentrated effort. Yeah, I have been successful in drinking in moderation, achieving recovery as I define it.
Now, let's just talk a little bit about like the labels that are around being an alcoholic. And I think that I love this idea of alcohol use disorder better than alcoholic, because that's like such a negative, heavy label that tends to stick with you for life. And I like this idea because I wouldn't want anybody to say, "Oh, you're an alcoholic." I don't think I am. I know I'm not. Like, I don't need a drink. Like, I don't there are on occasion, I have overindulged, but it's not something that happens regularly. And so if someone ever said that to me, I would be like, oh, well, that's pretty heavy. I don't really care for that label. Right. And I don't think that that's what I am. And so for you, what is the difference between being called an alcoholic and then just having alcohol use disorder?
The last thing we want anyone to experience is a label standing in the way of making a positive change in their relationship with alcohol. So I'm glad that we as a field have adopted alcohol use disorder as the modern medical terminology for a pattern of drinking too much, being unable to stop or control that drinking despite adverse social, professional, and or health consequences. And so to answer your question, alcohol use disorder to me is kind of the modern medical terminology for this problem that can be treated in a variety of ways, including with medication. Alcoholism doesn't mean a whole lot to me. It's kind of an outdated term, even if a very prevalent one. There are folks who find it helpful in defining their problem recovery, and I would never tell them to stop using it, but it's also not something that I'm going to try to impose on people.
Sure. I think they could almost use that as a crutch, like, oh, I'm an alcoholic, and it's like they always adopt that term as part of who they are, when I really just don't think that in my mind, any type of negative label that's going to hold you back and thinking better of yourself is not good, right? I would
look, there are people who I think can use it positively, who say, I am an alcoholic. In response to that, I am never going to have another drop of alcohol again. And if that works for them, fantastic. But I think you're absolutely right that there's a large group, I would venture to guess larger group, who are going to be turned off by the label, who want a different, better relationship with alcohol, but don't align with the definition of alcoholism or alcoholic. Ultimately, we've got to help all of those people. There are 30 million people in the US who meet the diagnostic criteria for alcohol use disorder, 60 million who are binge drinking monthly. We can't have one narrow label or one narrow set of treatment options if we're going to get those people the help they need.
Yeah, for sure. For sure. What's good, everyone? This is your host, Deanna Radulescu with Label Free Podcast. So I'm very much into my vitality, my health and wellness, fitness, all those things. So I love the telehealth concierge services. I'm not sure if you're familiar with those, but there's an online telehealth resource to help you with your health and wellness, sexual health, weight loss, peptides, what have you. And I really enjoyed the last therapy I did with them. This time I'm doing weight loss, you guys, because I've been a little bit slowing down here at this age, and I'm looking for something to boost that metabolism. I highly recommend Valhalla Vitality. I have a discount code for you, Deanna15, and I will have the link in the description below for you to go sign up. Check them out, get your appointment scheduled. You'll have a meeting with a great telehealth doctor, supervisor, consultant that will walk you through what it is that you're looking for to improve in your vitality. Again, this is Deanna Radulescu with Label Free Podcast, and I'm here to endorse Valhalla Vitality. And so now Oar Health, how does that help people? It's an addiction recovery platform. There's a revolutionizing way people approach alcohol use disorder treatment. And so now how does that work for someone that might be listening to this right now? I'm like, hey, you know what? I think that I'm ready to take control a little bit of what I've got out of control, and I'm going to check this out. And so if they're like, what does that look like for them?
Oar Health is private, convenient access to medication that is safe and effective to drink less or to quit entirely. The way it works is people come to oarhealth.com. They can learn about alcohol use disorder, medication-assisted treatment, a variety of related topics. If they think medication might be something that's useful to them, they can have a consultation with a doctor or other healthcare professional who can give them advice, put together a treatment plan, and when medically appropriate, prescribe medication such as naltrexone. At the member's option, that can be delivered to them privately, conveniently, in discreet packaging from one of our pharmacy partners. And then again, optionally, folks can layer on additional support, checking in with their medical provider, joining our private online community, attending our weekly Smart Recovery meeting if they so choose.
Excellent. And now the doctor can prescribe them as not, or actually, no, I'll take that. You answered that. Does any insurance cover this?
So we do not accept insurance. It is cash pay. Some folks are able to get reimbursement through their HSA or FSA.
Okay. And how affordable is it for someone, let's say, they're interested in this treatment?
Yeah, our plans start at as little as $39 a month. And so the majority of folks end up reporting that it pays for itself in less drinking, let alone the harder to quantify benefits.
Yeah, we know if you get on that freaking runaway train, it's going to cost you a lot more than $39.
Could pay for itself in one night for some of us.
Yeah. Oh, well, that's, yeah, exactly. And now, is there a requirement of how long they have to be a member for? And is there a separate cost for like having a doctor consultation?
The membership fee is inclusive of follow-up consultations. There is a one-time fee of $50 for the first consultation.
Okay.
But the ongoing membership includes as many follow-ups as is necessary. You can cancel anytime. The general clinical recommendation is if medication is helping, that it's generally a good idea to stay on it for a year. Kind of the common sense explanation there is this is usually not a problem that develops overnight. So good to give body, mind some time to rebuild, reset, rewire. And then it's a very individualized decision for members about when to stop taking medication, when to stop their Oar membership. In regard to the medication, ideally made in consultation with their healthcare professional.
Sure. Yeah, and I don't think I asked this before when we did our test run. Is there any side effects from the medication?
Yes, like all prescription medications, naltrexone does have side effects, or at least the
Okay.
risk thereof. For most folks, they're mild or they don't occur. The most common are nausea and other sorts of tummy troubles as someone adjusts to the medication. Those typically dissipate over a week or two of use and can be managed with things like taking with food or using over-the-counter remedies. Not quite a side effect, but also important to mention is that naltrexone is not appropriate for people who take opioids, whether those be
Uh,
prescription painkillers or any other variety.
Maybe on that runaway train.
Yeah, exactly. Will trigger withdrawal,
Yeah.
which is a scary and painful experience.
Oh, yikes. Okay. Well, I'm glad that we touched on that because I don't think we talked about that before. What it's like, well, actually, let me save that for the end. Uh, do you have besides yourself, and a success story, obviously not mentioning any names, of perhaps someone that joined as a member with Oar Health and has let you know, like, hey, this is what has helped me and this is how my life has turned around by being a part of your platform?
Yeah, it's definitely one of the most rewarding aspects of starting this business is hearing those sorts of stories. One that comes immediately to mind is a member I'll call Kay, and he described becoming more reliant on alcohol over years and years, in good times and bad, and doing what a lot of us do in moments of uncertainty, turning to the internet to look for a solution and stumbling across us, finding the notion of medication to be a bit of a ray of light into what was feeling like a very dark period in his life. So he signed up, got started with the medication. At first, wasn't quite sure if it was working at all, but started to notice some small benefits. Being able to drink fewer drinks, spending less time obsessing about it. And then a few months in, found himself at a family reunion where there was a lot of drinking going on that would have been a really high stress situation, high risk in the past. And after a few hours, looked around and realized that he wasn't drunk and the world was still spinning. And that felt like a real breakthrough to him, ultimately setting him on a path towards what he now describes as feeling liberated from alcohol. So it's kind of amazing how transformational just a small step, what begins as very, very small nuggets of progress can add up.
Yeah. And I guess I have a couple of questions around that. Like, I think there's two different things here. You offer a pathway where someone can take control of the drinking, whereas like AA, alcoholics, whatever you want to call it, they kind of like try to help you dig deep into what's causing you to self-soothe. So there's two different pathways here, and it almost sounds like he almost cured two different things at one time with just kind of taking control of that and not having to go down that dark, slippery slope of uncovering and all. I mean, I'm for whatever makes someone happy, right? But it sounds like this is a way different path, like a much more linear path to getting to your result than this over here, which is going to probably take a much longer time to get to a place where you're comfortable.
It's a terrific question, and I think an astute observation. Sometimes we think, or I've heard people say this, you'll never get a hold of your drinking unless and until you delve deep into the root causes.
Right.
And there are just a lot of examples that show that's not true. If drinking is kind of the main acute problem, I think it just makes sense to start by addressing that as directly as possible. And, where there is a seed of truth to that kind of old received wisdom is it's for sure true that drinking too much often co-occurs with stress or mental health conditions like anxiety and depression. I think, though, that just as you described, it's not one size fits all in terms of where to start. And often what we see is that just drinking a whole lot less can create room to make progress on any of those other challenges that may be arising. Maybe you find the time and energy to start going to therapy, as this member Kay I was just describing did. And even if you don't engage in direct treatment of those mental health challenges, drinking a lot less may mean that things start going a little bit better at home, at work, giving you time to engage in the other things in your life that are meaningful. And so you may see some improvement kind of across the board. So bottom line, no wrong place to start.
Yeah, no, I don't think I asked that before, and I just like that came like popped to my head. So, what is like the overall message that you want people to understand about what you provide with Oar Health and what it means to you and the difference that you want to make in the world?
What I hope we provide is an easy place to get started for anybody who wants to drink less or to quit. And I hope we're part of a broader project to expand the option set for anybody who wants a different relationship with alcohol. Expand the option set in terms of legitimate goals and outcomes. Sobriety is a great one, but moderation can be as well. And expand the option set in terms of how you get there.
Yeah.
Mutual peer support, for sure. Professional behavioral health care, like therapy, and also prescription medication when appropriate.
Yeah, love that. With that being said, Jonathan, where can people find you, connect with you, and learn more about Oar Health?
Best place to start is oarhealth.com, OAR health.com. One of the options there is to schedule 15 minutes to chat with me, just as we're doing here. And I would invite anyone who's interested in this topic, whether for themselves, a loved one, or more generally, to do so.
Yeah, I love that. Thank you for that. You guys, I'm going to put that link in the show notes. So if you connected with Jonathan's story or what Oar Health is doing in the community around alcohol use disorder, go click the link, go schedule your call, and just see where it takes you. No right, wrong, or bad way to do whatever you got to do. You know, we're here for you no matter what. Jonathan, this is a part of the show where I like to ask for last words of wisdom or advice. What would you like to leave with us today?
The recovery from problems with alcohol is possible. I'm one example of that. There are millions more. Number two, that the options to achieve that better relationship are likely more numerous and more varied than you're aware or led to believe. And thirdly, that it's never too early or too late to start making positive changes. You don't have to wait to hit quote unquote rock bottom. But on the other side of that coin, no matter how dark and difficult things feel right now, a brighter and more hopeful tomorrow is possible.
Yeah, absolutely. I love all of that. You know, you don't have to label yourself for what you're going through right now. And if you want to just kind of go a little bit more linear path, go to oarhealth.com. I think that is just such a great, better option than some of the other things to me personally. Jonathan, thank you so much for sharing your story. Thank you for doing a repeat. I think this was even better than the first time. So, you know, there's a reason for everything, but I appreciate you. And thank you so much for sharing your story.
Thanks for using your platform in this way.
You're welcome. You guys, this is your host, Deanna Radulescu with Label Free Podcast. To live your best life, you must live label free. As always, don't forget to subscribe, follow, rate, review, comment, share, all those good things. And I'll be back soon with more dynamic guests.